In this video, I'm going to teach you the action first, situation next approach. This approach is very helpful whenever you have a very lengthy or long questions. And usually in this kind of scenarios or OSCE stations, there will not be much history, there will not be many symptoms. Mostly it is like a communication statement scenario. For example, like breaking bad news or counseling station. Usually when you have such stations, this approach will be very useful. When I actually did a mock exam, a couple of years ago when I was preparing for my clinical exam, I had this particular scenario, and that's when I actually thought about this approach. Anytime you have a long or lengthy stem in the scenario, for example, the scenario given on the screen, this is something I just sat down, before I started doing this video, and I just typed something. So whenever you see a big scenario like this, where you look like there's too much history given, what I would do is I would just go to the action first, which is what is it they're expecting from you, what is the action they want you to do. So I usually go to the action first. So it says that explain that she has herpes and give advice on safe sex. See, when you read the tasks that are given, now it's very easy for you. Now you go back to the scenario and you actually quickly glance the scenario. Sandra, 24-year-old female at the clinic, wants some advice, worried, weird disease, get advice, taking the pill, no known medical conditions, no allergies, family history of ectopic pregnancy, but she was not pregnant, has a boyfriend, she has sexual intercourse, stranger at a pub last night after she had some recreation drugs, she had some casual partners in the past, she has some painful lesions on her genitals. See, this was a similar scenario I had in my mock exam. I just tried to quickly type something here. Whenever you look at such lengthy scenarios, this is what I do. Whenever the scenario is very lengthy, the first thing I do is I will go to the task first. I will see what they're asking. Sometimes the task they ask might be completely not related to the scenario at all. There was another scenario where it was a very big lengthy scenario where the mother of the patient had severe pain and she was crying in pain. The daughter lost voice suddenly. In that scenario, I used this strategy. This was again in one of my exams. The scenario was very lengthy and I could see that, okay, just looking at the scenario, I could see that this is probably a bit tricky one, maybe a counseling station or maybe a history taking station. That's when I usually use the action first, situation next approach, where I actually go to the actions, which is the tasks that are asked, and I look at the scenario. So explain that she has herpes and give advice on safe sex, or counsel the daughter that it's not a serious problem and all that is happening with her mother is she's having some pain. See, it has got nothing to do with the scenario that was given. So whenever you see lengthy scenarios, make sure you use this strategy. Action first, situation next. And see, once you do this, once you actually read the tasks only, now it's easy for you to go back to your scenario and just look for the most important things, because now you know what you have to talk to the patient. Like you have to explain to the patient that she has herpes and give advice on safe sex. Now you clearly know what you have to talk to your patient. So now you have to go and look for things that will help you explain this to the patient. I hope you got what I'm talking in this approach. This comes with practice, and anytime you see a lengthy scenario or a big scenario, make sure you read the tasks first.